Hey everyone, welcome to my channel. My name is Nurse Jem, and I'm here for all your nursing questions, your nursing skits, and anything that has to do with nursing related. I want to give you the information so that you know just how difficult it is to be an RN. So let's get started, and today's topic is money. Stay tuned. First ad that I want to look at is for a registered nurse position at Avonlea Cottage. The pay is for $19 to $25 an hour, first shift with weekend availability, full time. So that tells me that they are extremely short-staffed on the day shift. This is a perfect example of nursing homes not paying their staff correctly. $19 an hour, the lowest, which is presumably for the newer nurses. This isn't for LPNs even, this is for RNs. So as a brand new RN, you can expect to get paid $19, maybe $20 an hour. That is ridiculous. I want to give you some background information on this facility. I did work there when I was a newer nurse, say maybe about a year into my nursing career. This is an assisted living. It's about 30, maybe 35 residents. So that means at any given time there's only one nurse and usually two CNAs. When you hear assisted living, you think that the residents are a little bit more capable to care for themselves than someone who's in a nursing home. And that can be true, but that's not always the case. So what I mean by that is people who live in this assisted living still need help going to the bathroom, feeding, changing their clothes. They still are fall risk. Sometimes they need help transferring, even simple things they need help with. The pay is extremely important to note here because $19 an hour is the lowest that they're willing to pay, or the highest that they're willing to pay, in this case probably for a new RN. And I want to show you something that's really interesting. Let's look at the next slide and keep in mind that to become an RN, you need to go to school for a minimum of 3 to 5 years. And that includes prerequisites and the actual nursing clinical itself. For myself, I went to school to be an RN. It took me about 4.5 years because I did it the long way. I went from a CNA, an LPN, and an RN. Sometimes you just, go in, get your RN, get your BSN, but still, you're looking at about 3 to 5 years minimum to become an RN. Let's keep that in mind, and also keep in mind the $19 an hour as we look at the next ad. For people who don't know what a phlebotomist is, they are typically seen in hospitals and doctors' offices. They do blood draws. So when you say you need a certain test, like say an A1C or cholesterol, those are the people who would be drawing your blood typically. I'm sure that you've seen them when you've gone to hospitals. Maybe you're in an emergency room and you have a difficult vein and the nurses can't get blood drawn for whatever reason, so they ask the phlebotomist to come in, and usually they're able to. Phlebotomists do not have any direct patient care in the same way that a nurse would. Nurse assumes all responsibility for that patient in all aspects of their care. The ad says $19.31, 31 cents an hour more to pay someone who has significantly less education and maintains significantly less responsibility is just mind-boggling. The next ad I'd like to look at is for a CNA position. That means Certified Nursing Assistants. So for those of you who don't know the ranking system of nursing and nursing assistants, it goes CNA, Certified Nursing Assistants, LPNs, Licensed Practical Nurse, and RN, Registered Nurse. As I said before, I worked my way up. I was a CNA, an LPN, and now I'm an RN, and I've been an RN for a while. So this ad is for next staff. It is an agency. I did work here also, so I feel like I can contribute some personal experience to this one as well. And we see here that this position is for $20 an hour. Well, what is agency? What's traveling? What does that really mean? Okay, so this is an agency, which means that we are sent to different nursing homes throughout whatever area you live in. So for me, I live in Northern Illinois. What's great about agency is you can choose the nursing homes you go to. You can choose where you work, when you work,
etc. There's a lot more flexibility than if you just worked in the same nursing home as your permanent position. So for $20 an hour, you can start off as a brand new CNA in this agency. If you were a CNA in a nursing home, I have seen it as low as $10 an hour and as high as $16 an hour. So let's say in the middle you're making maybe an average of $13, $14 an hour as a CNA, when you can go to agency and make $20 an hour. And the funny thing is, because nursing homes are so short-staffed for nurses and CNAs, you can go to agency and you'll probably be able to go back to the nursing home that you were working in originally, but this time do it as an agency or as a travel nurse and get paid, 1.5, if not 2 times as much money. Let's look at the final ad for an RN position at Next Staff. This is what I was doing. So we see the pay is $45 an hour. Now remember back to our original ad at $19 to $25 an hour for an RN. So we're going to be making almost $25 an hour more for the same title. And you can do this as a newer RN. There's no requirement like you had to have 5 years of experience on the floor. You don't. So right on day one, you're going to be making pretty much twice as much money. And same thing with the CNA, the flexibility. You can work in a nursing home when you want, where you want. If you don't like that facility and you only go there for 1 day, you don't have to go back. Or if you're a staff nurse, you now have to go there every single day. The ad at $19 to $25 an hour. I know they're short-staffed because they want day shift, they want full-time, and they need weekend availability. Those are the 3 bugaboos. No one wants to work weekends, no one wants to work first shift, and no one wants to work full-time in a nursing home because you are definitely going to get burnt out. So what happens? What happens when nursing homes don't have enough staff? They hire agency. They have to pay agency almost twice as much to fill their positions, right? So they offer such low rates. People like me look at this and think, yeah, I am not doing that for $19 to $25 an hour when I can go to agency and make twice as much doing the same amount of work. It doesn't make sense. They need to provide nurses with a reasonable wage. You're asking them to take on a huge amount of responsibility when you're in a nursing home. I once had 64 patients to myself in a nursing home, and maybe 2 CNAs. That is so much responsibility to offer someone $19 an hour. That is a joke. And that's exactly why they have to pay agency to come in at twice as much amount of money, because they refuse to pay their nurses a reasonable wage for all their education and all their responsibility. Well, the moral of the story is nurses need to get paid a living, reasonable wage, especially nursing home nurses. We take on so much responsibility. Nursing homes have IVs, PICC lines, wounds, catheters, feeding tubes. The only thing that we don't do in the nursing homes, blood transfusions, and of course, obviously it's like surgeries, but we have complex patients just as that you would find in a hospital setting. You have to pay your nurses a reasonable wage, otherwise they're going to go to agency, just like I did. And then the nursing homes are going to be even more short-staffed. They're going to be losing money. I am in no way, shape, or form putting down CNAs or phlebotomists. The point of this is to say that nurses, especially nurses in the nursing home, need to be paid a reasonable wage, and $19 an hour is not reasonable. For all the education and responsibility that we take on, $19 an hour is a complete joke, which is why the ad is still up a month later, because I highly doubt that they had anyone coming in and saying, yes, I will do this for $19 an hour. No, absolutely not. If you are a nurse working in a nursing home right now, I want you to know that I hear you, I know your struggles, and I want you to know that you are so important to the healthcare field.